Detox products and programs promising miraculous results have flooded the market, taking advantage of our desire to lead a healthier life. However, I'm here to reveal the truth. My name is John Damianos, and I'm a clinical fellow in gastroenterology and hepatology at the Mayo Clinic in Rochester, Minnesota. I will guide you through an exploration of how our digestive system and detoxification systems actually work. Many of these claims are not only false, but many of these programs and products can actually harm your body. While many of these products may seem appealing and attempts to convince us that they hold the key to a healthier life, the reality is actually quite different. Extreme diets, excessive fasting, questionable supplement, detox powders, and even invasive procedures such as enemas can disrupt our body's delicate detoxification processes. That's why I've created this session, Unmasking Harmful Detox Claims. With this knowledge, you will be better equipped to separate fact from fiction when faced with the constant bombardment of misleading detox claims. My goal is to empower you with the information necessary to actively promote healthy detoxification in your body. And together, we will explore what you can do to achieve that. Gut health is really having its moment right now, and it's no surprise in my mind, at least, because we've known since essentially antiquity how important the gastrointestinal system is with respect to systemic health. There's an oft-cited quote from Hippocrates, considered the father of modern medicine, that all disease begins in the gut. Now, this is obviously a bit of an overstatement. Nonetheless, we have come to realize that the digestive system does a lot more than just help us absorb our nutrients and function as the digestive and alimentary system. We know that the gastrointestinal tract is a center that interacts with most, if not all, other organ systems. And it does this through the microbiota, so the trillions of bacteria, viruses, and fungi that co-inhabit our gut. It does this through the enteric nervous system, a component of the autonomic nervous system that acts as our second brain. And it's called the second brain because it's actually the only part of the nervous system that can function completely independently without any input from the brain and spinal cord. It also does this through interactions with the immune system. A lot of our immune trafficking begins in the gut and is regulated by what happens in the gut luminal microenvironment. There are also neurotransmitters that are produced, metabolites that reach the brain and all other organ systems, and connections with the endocrine system that allows for communication with other organ systems as well. And because of the multifaceted nature of what occurs within the lumen of the gastrointestinal tract and leads to downstream effects affecting most organ systems, we've come to realize that many disease states, not just within GI and hepatology, but systemically, have some component of pathogenesis that involves the gut, whether that's abnormalities of the gut microbiome or changes in neurotransmitter signaling, problems with motility. It opens up the possibility to potentially preventing these diseases or modifying the disease courses, and in some cases, even treating diseases by targeting the gut or the gut microbiota. And we know that in some cases, the relationship is not clear. But what we do know is that maintaining gastrointestinal health is essential to maintaining systemic health. And a lot of other disease states that historically have been thought to reside in other organs, Parkinson's disease being a classic example, often thought as a neurologic disease because its primary effects are neurologic. We know that the initial symptoms of Parkinson's are gastrointestinal, manifesting 10 years prior to any neurologic symptoms. And so again, this raises the possibility that perhaps within the pathogenesis of Parkinson's disease, there's something that occurs within the gut microenvironment that triggers chronic neuroinflammation, eventually manifesting in the neurologic changes that we see in Parkinson's disease. And so this is just one of many examples of diseases outside of the gastrointestinal tract that seem to have a particular importance with respect to their pathogenesis in abnormalities that begin in the gut. I'm John Damianos. I'm a clinical fellow in gastroenterology and hepatology at the Mayo Clinic. My passion is chronic digestive illnesses, particularly as they pertain to the gut microbiota and disorders of gut-brain interaction. I am particularly passionate about these types of disorders because for a long time they have been misunderstood. And to this day, a lot of misinformation about these types of disorders. Patients often take a long time before they get proper diagnoses. And so I take a lot of joy in sitting down with patients and getting a comprehensive history and using the fairly advanced testing that we have available to help identify the root cause of their digestive illness and help restore them to health. That's really what gets me up and going every day. So I said earlier that gut health is having its moment. And as a gastroenterologist, that profoundly excites me. At the same time, it scares me a little bit because things that become popular often allow for the proliferation of misinformation. And we live in a time right now where social media and things like Twitter and TikTok play such a central role in informing people about particular issues. And that has served many positive purposes. At the same time, in the medical community, particularly, I would argue, in the gut health space, this has proliferated tremendous misinformation. And in fact, even the term gut health is not usually something that you hear from physicians and gastroenterologists because it's been hijacked by pseudoscientists. There are a lot of unfounded claims out there about gastrointestinal health. And some of this, again, comes back to Hippocrates saying all disease begins in the gut. Some people take that just way too far and make unfounded and potentially even dangerous claims about gastrointestinal health. We see this a lot in the probiotics world, which is a world that I have a lot of familiarity with as I've been involved with multiple international probiotics research groups, and my own academic research is in probiotics. There's a lot of misinformation about probiotics, diets, supplements, and even certain procedures that are done out there to address gastrointestinal health. And I see a lot of patients who have very difficult to diagnose and difficult to manage chronic gastrointestinal diseases. And these patients have often seen multiple doctors and even people who are not doctors because they're so desperate to find an answer. And these people are disproportionately targeted by pseudoscience and misinformation. I completely understand why a patient who may have been dismissed by other doctors or hasn't gotten to their diagnosis yet would search for other avenues of trying to get to their symptoms. And so when somebody else says, oh, this is what you have and take this supplement or this protocol and it will solve your issues, of course they're going to listen. That makes total sense. But what really angers me is that it targets disproportionately these unfortunate patients who suffer chronic digestive illness. And this is certainly not restricted to gastroenterology. This is true in many different conditions, including in the cancer world and oncology. But I see this a lot. My patients who get told these lies and pseudoscience to be taken advantage of by these individuals who are just trying to sell their supplement or their protocol. And oftentimes it only leads to financial toxicity, but on occasion it leads to real medical and psychosocial harm.